joints, all right? Where are your AC joints? Pointing towards the end, because your clavicle, remember, comes down, and on the lateral aspect, it meets up with the acromion, and that is the AC joint, acromioclavicular joint. So these can be done bilateral. Bilateral means both sides, or they can be done unilateral. So you have to look at your order when they come in. If the order says left AC joint, then you would only be doing the left AC joint. In that case, you would just be collimating down to 10 by 12, crosswise, single side, right? Getting the clavicle and the AC joint. Most places do bilateral, and that's what we're going to go through today. So we're going to make sure we have both AC joints included on our image. To do that, y'all, that's a pretty big distance, right? From right to left AC joint. So we back our tube up, 72-inch SID, all right? Detent to the wall bucky. Are we detented to the wall bucky there? Make sure your angle is horizontal, 90 degrees coming in. Are you on wall bucky? Make sure your tube is set at all. There you go, and you're set at 72 inches. Yes, so you have to be detented above. This is the same setting that you use for your chest x-rays, right? So think about this. The reason we're using the 72-inch SID, not only because we need to get both AC joints, but you got to think about the divergence of the beam. Do y'all know what that word divergence means? It spreads out. If you've ever held a flashlight close to something, that beam is pretty concentrated to that area, right? But if you take that flashlight and you move it away, the light spreads out on whatever you're shining it on. Same thing happens with our beam. So at this distance, our beam is going to have a wider path as it gets to the part. Y'all following me? Mm-hmm. So therefore, we're going to have to make sure that, so that's helping us get both AC joints on the image. It's also minimizing distortion, because when that beam is coming like this, these x-rays out here on the edges are running like that, right? So that's going to make our joint space look pretty awkward. Well, because they're separated so far and the divergence of the beam, that is what helps us to keep that distortion minimized while getting both AC joints. If you want the truest representation of the joint, you're going to do a unilateral and focus on just that joint. Does that make sense?
Yes, ma'am.
Most radiologists want to compare the two. If there's an injury to one, if you can look at both, if they look the exact same on your image, the chances of there being an injury is a lot less than if you see one that looks completely different than the other side. There's something going on, right? That's going to help them narrow down what could have happened to the AC joint. So most places most places do bilateral AC joints. 2 images are done with these. One without weights, one with weights. Why do you think we would use weights? So we're trying to separate that joint space and look for injury in that area, right? Fractures, any kind of abnormality to the joint space itself. So that's where this gets a little bit tricky, but let's do the image without weights first. 72-inch, 72-inch SID, 90-degree angle. We are going to find her clavicles, okay? Patient would have to remove everything from the waist up. Necklaces would come off, any snaps or buttons. Y'all, if you put a gown on a patient that has snaps right here, and a lot of them do, right, that snap up at the top, you'll have to unsnap that gown and make sure those snaps fall down so where they're not in the clavicle area or the AC joint area. Make sure those snaps are not in your field of view. So everything would have to be removed out of that area. And then you're going to line up your horizontal line to the AC joint itself. The central line, everybody watching, it's coming jugular notch. That's going to be coming through mid-sagittal plane. Y'all remember mid-sagittal cuts your body into equal right and left halves. All right. So what we're looking at here, we've got our 14 by 17 in crosswise. Center line should be coming, jugular notch. I'll be careful when y'all are poking on somebody's jugular notch. That's a sensitive area. Have you ever had somebody touch you right there, or when y'all are practicing, you touch each other? Sensitive, right? So don't go poking real hard, be easy. So here, mid-sagittal plane, not only am I making sure I'm mid-sagittal plane, I'm also looking over here on the side, making sure that I have both sides even, okay? Collimation, they told you in the book, you keep that 17-inch width unless you have a very small patient. You know, if you have a very small patient, you can collimate in some. Most adults, we're going to keep the 17-inch width. Make sure the back is all the way against the IR. There's no rotation where one shoulder is forward, the other is back, okay? Arms are going to be down by the patient's side. And make sure your patient's not leaning one way or the other. Feet shoulder width apart. Make sure those toes are on the same plane, okay? And then hit your, what did your book tell you for collimation?
6 by 17.
6 by 17. So go ahead and collimate down to 6 by 17, which should give you a little bit of light above your shoulder. We got light above our shoulder. So marker, the book tells you to put a marker on both sides, and that is usually what we do. We put the right on the right side and the left on the left side. There. Be careful, don't put it in that shadow. You're going to get it in your anatomy. You could open this up just a little bit more. So I've got both sides marked. Shield, make sure you're shielding the reproductive organs. Your book tells you to use a thyroid shield. Okay, that's a little collar that we can use. Most thyroid shields, though, if you're in a facility that has a thyroid shield that has a little loop of lead that kind of comes down, don't use those because it's going to cover up the SC joints, which are your sternoclavicular joints. And that's going to be in your anatomy. We don't want any part of the clavicle covered up. So only use thyroid shield if they have one that does not interfere with your image and your anatomy. With me? Most of the time we don't use thyroid shields. I'm just going to be honest with you. Okay? We do cover the lower part of the body. Now, breathing instructions for this. Suspend respirations. What does that mean? Hold your breath, don't breathe, don't move. Beep. That is AC joints without weights. Next, we're going to give our patient weights. Weights are anywhere between 5 to 10 pounds. I want to hear y'all talking to your patients when you do this. We do not allow our patients to hold them in their hands like this. When they do that, what happens is the muscles in the arm tend to tense up, and so it raises the shoulders up, okay? So we don't hold them like this. This is a no-no. I don't care who you see do it, it's a no-no. With me? So what we do is we affix them. I like that word, affix. We affix them to the wrists. So we tell our patient, okay, patient, I'm going to give you these weights to hold in your hands. What we're going to do though is we're going to put them on your wrist and hold them like that. I don't want you to tense up your shoulders. I want you to keep your shoulders nice and relaxed, okay? It'll be real slow and easy. We're just going to let them rest right down by your side. Got it? You okay? All right. So you got to work really quick once you get these on the wrists. One on this side. And just let it relax your shoulders down. So once we have weights on, check your centering. Make sure she's still centered. Make sure you don't need to bring your central rate down any. She's fine. And then we're going to give her breathing instructions, which are hold your breath, don't breathe, don't move, beep. Take those weights off immediately. Got them? Yeah. Those are heavy, aren't they? Yeah. Those weights can be anywhere from 5 to 10 pounds, all right? So you gotta work really quick when you give them to them. Make sure the shoulders stay nice and relaxed, and then you expose.
That was a good stretch.
Any questions about AC joints? with and without weights. Got to do both for comparison. All right.